Thank you everybody for joining us today. We have a very interesting topic that we're going to be talking about this afternoon. And in order to get started with just a little bit of house rules, which is please remember to keep your mics muted, right? During the presentation, there will be opportunity for you to open your mics and participate later on in the meeting. If you have any questions, feel free to put them in the chat. That way our guests can also see them and then address them. And of course, stick around for the breakout room so that we can have those amazing conversations um, after the presentation. So we're going to go ahead and get started, and we're going to let Gio present our guest for today.
Yes, so hello. I am particularly happy to introduce our guest speaker. Why do I say that? Because it doesn't happen all the time that one of our fellow interpreters is also knowledgeable in terms of being the provider of those services. And so I had the pleasure and I had the honor to participate at the CCHI Summit. For those that don't know, CCHI is the Commission for the Certification for Healthcare Interpreters. And I was both representing AAIT, but I am also a medical certified interpreter. And I went to Devin's presentation and I'm like, oh, that has to be ours too. And so I reached out to Devin and I asked if he could join us at AAIT. Devin, and I hope I'm pronouncing this correctly, Devin Lukacic is a certified Spanish healthcare interpreter, but he's also a speech language pathologist. Therefore, he specializes really at the intersection of the two fields. So he brings to us the expertise and the knowledge of a number of different communication disorders. So this is one of the areas where interpreting and translation in education intersects with the healthcare. And we may have these encounters during IEPs, for example. And so I asked Devin if he could join AAIT for an EduTalk so that we could discuss how we around the country are dealing with these type of sessions. Some of us as freelance interpreters may be less exposed, and some of us as staff interpreters may be more exposed in doing more IEPs. It just depends on what the policy of the school and the district is going to be. Definitely, translators may have a number of these texts to translate when they translate the IEPs for the families, depending on what the stage they're in. As he continues his study in speech pathologies, he also continues his work in interpreting. So without further ado, I would like to leave the floor to Devin. Devin, thank you so very much for joining us. And the format is going to be the same. We are going to listen to Devin for the very first 20 minutes. We're going to go in breakout rooms, come back, and Devin is going to help us wrap up, but you will have a moment to really dive into conversations regarding this topic. Devin, thank you. Take it away.
Yes, thank you so much for that introduction. So yes, I am a healthcare interpreter. I hope everyone can see my slides here. I've been a certified English-Spanish interpreter for going on 6 years now. And in that time, for the last 4 years at least, I have interpreted almost exclusively for speech-language pathologists. So that's an area that I have found really interesting and that I've decided to specialize in interpreting for, and I'm now well on my way to becoming one. So I'm in my internship year. Speech-language pathology requires a master's plus several hundred hours of clinical experience. So currently I'm in my internship with one of our level 1 trauma center hospitals here in San Antonio, and I work with individuals post-stroke, traumatic brain injury, and also our populations with head and neck cancer. And prior to that, I was in rotations in the school settings. And so this interaction between interpreters and speech-language pathologists is one that gives rise to a lot of challenges, given that our populations inherently have communication disorders at their baseline. And so it's one that's often difficult to navigate from both sides. And I hope that today leads to some really great discussions and gets us sort of thinking about some of the ways that we can navigate these challenges. I don't have all of the answers to some of the questions that I'll pose today, but I hope that we get to really discussing them, because this is something that is still an ongoing challenge and an ongoing project that interpreters and speech pathologists have been trying to navigate for a long time. So, as I said, I really want to create a space for discussion and questions about these interactions more than anything else. But throughout this presentation, I will also talk a little bit about the scope of school-based speech pathologists and the types of services that we often need to use interpreting services for and collaborate with interpreters for, as well as touch on 4 different communication disorders that are the most prevalent, I feel, in the school settings that you may encounter. And we'll go over a little bit of each of those. So this is kind of a broader outline of some of the scope of speech pathologists. So those of you that are healthcare interpreters will also encounter SLPs in healthcare settings. We deal with a wide scope of communication disorders, voice disorders, swallowing, upper airway problems, anything involving this head and neck region, essentially. But the ones that I have placed the arrow with are those that are most prevalent in the school setting. So speech pathologists primarily in the schools help with disorders of articulation, motor speech, like childhood apraxia of speech, feeding and fluency disorders, oral rehabilitation, so children that have been born deaf or have acquired hearing impairments early in life, often suffer some speech delays as well from not getting all of that input. Language disorders, augmentative and alternative communication devices, and craniofacial anomalies like cleft lips and cleft palates. So I won't be able to cover all of these today, but these are some of the things that you'll see, at least in the school settings, that SLPs will work with. It's important to understand that sessions with an SLP can vary really drastically. So an initial evaluation, for example, is going to look a lot different from the actual therapy that we're doing. In an actual evaluation, we're doing a lot of assessments, and most of these assessments are standardized. And in order to give these assessments with interpreters, requires a lot of training from the speech pathologist to the interpreter, and a lot of nuances to that. Whereas with therapy, there's still a lot of data collection going on, but you may see really different things. We also have big differences between our individual therapy and our group therapy settings. And typically in the schools with really high caseloads that SLPs tend to have, you do a lot of group sessions, and that in itself can be challenging for interpreters to navigate. Push-in therapy versus pull-out therapy. We're either coming into the actual classrooms with the teachers, or we're taking kids out for individual or group sessions. Sessions can be in person, or of course, as we've learned during COVID, a lot of telehealth became quite popularized. And of course, you'll encounter the SLP in IEP meetings, 504 meetings, all types of meetings that we know and love. There's also kind of nuances to research and test development. So I currently work with Western Psychological Services, and we're developing a standardized assessment for pediatric speech and language in Spanish. And as we'll talk about a little bit on the next slide, we have very, very few SLPs that actually speak Spanish. And so we collaborate with a lot of interpreters to make that happen. And so we even need interpreters that just kind of get to understand the assessments and the data that we're looking at for research purposes so that we can help develop these tests. And as I said, the vast majority of SLPs do need to collaborate with interpreters. Over 85% of SLPs, or even up to 91%, according to some surveys, are white, and only 8% of us speak another language. Of those 8%, only half actually possess the training to be considered bilingual service providers. So our regulating organization, ASHA, has ways that they give that credential out and determine that you are a BSP, and only about half of us actually meet that criteria that we can provide services without the need of an interpreter. So 4% out of the total pool of SLPs, 2% total are actually BSPs in Spanish. And I know we have a lot of people that interpret here for other languages other than Spanish, but I'm here in San Antonio, And I can just say from experience, we have a huge need for Spanish interpreters here. It's also important to note that evaluation of a bilingual or multilingual child absolutely necessitates that their skills be evaluated in all the languages that they speak. So if we have a child, for instance, who seems to be producing some errors in English, whether they be articulatory or phonological or semantic errors, but they speak another language or have a different background, we can't really make the determination that this is a language disorder or an articulation disorder in English without testing the other languages that they speak. We have to determine that the errors are consistent across different languages to say that this is an intrinsic language disorder rather than their English being affected by another language. And to do that, we have to use interpreters 90% of the time. Functional speech and language therapy also has to target all of the languages a patient or client speaks. So if a child is bilingual, we're not wanting to just do therapy in English. We want to do therapy in both or all of their languages. And to do that, we really need to partner with interpreters. So all of this is just to say that we really need interpreters that are well-versed in some of the nuances of speech language pathology. And unfortunately, there's a really big shortage. I find that a lot of interpreters are intimidated to work with SLPs. Some of it necessitates kind of stepping a little bit outside of the typical scope of interpreters, outside of the comfort zone, to help us gather some of that data. And so that's what I'm here to talk about today. So as I said, I am going to cover just 4 of the most common communication disorders that we see in school-age children. And then as we go into our breakout rooms, I want all of us to kind of discuss at least one of these and how they might impact the session. So I'm going to pose a lot of questions, a little bit of information, and things that will hopefully lead to more meaningful discussion. Starting with articulation and phonological disorders. Now, at the top of each of these slides, I've put a few relevant vocabulary terms that are a little bit more out there, a little bit less known, just for your reference. But articulation and phonological disorders are characterized by misproduction of individual sounds, or we call them phonemes. They're the individual units of sound that make up language. And they are the most common form of communication disorder that we see in children in the educational settings. So the way that this can impact an interpreting session, firstly, is that children that have multiple sounds and error can be really difficult to understand. At times, especially if they have different phonological processes going on, that means that they're systematically and cyclically replacing certain sounds with other ones. And if there are multiple processes occurring at the same time, it can make them really unintelligible or really difficult to understand the message. Another thing that makes it difficult for interpreters with this population is that they often require extensive data collection and identification of disordered phonemes on the part of the SLP. We're the ones who collect the data and make the actual diagnostic decisions, but we can't do this without the interpreters having some semblance of what kind of data we're looking for and how to relay that to us. Furthermore, the interpreter is really the sole expert in the sounds of the language that they interpret in. And so the SLPs are going to often want to consult us for how these sounds should typically be produced in that language, because the SLP doesn't speak the language. The interpreter is the true expert here. And so a lot of interpreters, as I said, feel a little uncomfortable kind of providing that sort of expertise from their part, because it's not something that we're trained to do. But when working with SLPs, it's essential. And so 2 of the questions that I want us to consider with this population is, firstly, how should an interpreter record and explain the errored sounds that they hear a child produce in their language? So if we're giving an assessment or we're doing some form of treatment, the SLP is taking data on sounds that are misproduced, substituted, replaced with other sounds. And as you're hearing that in this child's language as the interpreter, how can you relay those things? How can you record, transcribe, and explain them to the speech pathologist in a way that informs their assessment? And there's no perfect answer to this. It's something that a lot of people have been trying to work out. And so I kind of want to hear people's ideas on this. Secondly, what should the interpreter do when a child's message cannot be understood? That's just something that I'll leave us to think about as well. Going into our next population, fluency disorders, very common in our school-age children. Fluency disorders are characterized by the interruption of the typical flow of speech. And so the most common disorder of fluency that we think of is stuttering although there are others, they're clutterers. And so when we have a child with a severe stutter, for example, sometimes we have these long blocks that can make it difficult for the interpreter to keep up with or even identify the original message. And not just for the interpreter, but for anyone listening. Sometimes when we have stutterers that have really long blocks in their speech, it's harder to follow that message through to the end. Furthermore, talking to an additional unfamiliar party like the interpreter can be anxiety inducing and actually exacerbate the disfluency. And so research has shown that while stuttering isn't an anxiety disorder, it's neurogenic. It occurs from changes in the brain. There is an anxiety component for many people. And so there's research that shows that people have or experience more disfluencies when they're in front of an audience or when they're in front of multiple people or unfamiliar people. And so sometimes even just having that third party of an unfamiliar person, an interpreter, can be anxiety inducing and disfluency inducing in and of itself. And finally, identifying the patterns of disfluency and again, taking that data can fall partly on the interpreter. And that's just a really difficult thing to really navigate how we're going to get that data across from one language to another, from an interpreter to a speech and language pathologist. How are we going to make those connect? And so the questions I want us to consider for our fluency disorders and our stutterers are: to what degree should the interpreter replicate disfluencies in their interpretation? And so when I say disfluencies, I mean blocks, stutters, syllable repetitions, part word repetitions. To what degree does the interpreter render these in their interpretation? And secondly, how can the interpreter facilitate the collection of data by a speech pathologist with regards to the number, type, frequency, and rate of disfluency? And these 4 parameters that I've just mentioned are parameters that we as SLPs frequently will try to collect data on. Now, of course, the briefing and debriefing process is really important when it comes to any of these interactions, because depending on the type of data the speech pathologist is looking for, hopefully they would relay those things to the interpreter, and there can be some conversation about how to go about that, but it's not always simple. And so I've witnessed a lot of sessions that have just gone really awry because the SLP either hasn't explained exactly what they're looking for, the interpreter doesn't know exactly how to relay what the speech pathologist is looking for. And so again, with disfluencies, sometimes we want to track the number of stutters or the number of breaks, the type of disfluencies, is there are different types to learn about, the frequency or the rate. Autism spectrum disorders are another population that SLPs work with frequently, very common in the school settings. These are characterized by neurological differences that restrict interest in social interaction. The SLPs do often design interventions that target social communication with our populations with autism or ASD. Some autistic children do exhibit challenging or distressing behaviors, and that's something that a lot of interpreters sometimes have a difficult time navigating. Many of them will not engage with or reciprocate interactions with the interpreter, of course. And the level of understanding and acceptance of the diagnosis, as well as the extent of its terminology, varies so much by language and culture. And so that can impact the interpreter's ability to explain it to families or to confidently relay some of these things in another language or to someone with a different culture and different perspective on ASD. 2 things I want us to consider are: firstly, how could the inclusion of an interpreter impact a session with a child who is echolalic? And so echolalia is this idea that the child repeats the things that they hear. Some people call it like that parroting language. And so if I've seen several sessions like this, but if we have a speech pathologist who's rendering one message, the interpreter is interpreting that message, and then we have a child who repeats everything that they hear. Think about how that can go a little bit awry, and what could we do? And as the child's direct communication partner, how much of a role does the interpreter play in trying to get the child to engage and communicate socially? And so this can vary depending on the type of session, but a lot of times we do have goals for these children to interact socially and to engage in social communication. And when the interpreter is the actual child's direct communication partner, the person that is talking to them in their language, a lot of times these goals will be built around the interaction between the child and the interpreter. And so I want to to consider a little bit about how that can work and how much of a role does the interpreter or should the interpreter play ethically and comfortably in that interaction. And then the fourth one I want to talk about are developmental language disorders. And these, in a lot of languages, have a history of going by a lot of different terms. So English is no exception. We've had it be called SLI, LLD, DLD, all sorts of other things. In Spanish, I know it's also gone through a lot of reformation in terms of the terminology, but these are essentially characterized by the difficulty producing or understanding linguistic constructs. It's also important to note that these have a really high degree of association or comorbidity with autism spectrum disorders, ADHD, ID, Down syndrome, and dyslexia. And so these children with expressive language deficits, for example, can produce sentences with really problematic grammatical structure that may not be entirely semantically intact, whereas those with receptive language impairments might not totally understand what the interpreter is saying and have difficulty grasping that message, especially when they become more linguistically or syntactically complex. And of course, we can have our children with both expressive and language deficits, and these range on a spectrum from mild to severe. It's also important that treatment for this population might require the interpreter to have some knowledge of grammar, syntax, semantics, and morphology in the target language in order to understand what is grammatically correct, what is syntactically intact, and what isn't. So again, you guys as interpreters are the experts in the language that you're interpreting. The speech pathologist is the expert in linguistics in general and linguistic theories and things of that nature, but only you know the syntax and semantics of the language that you're interpreting. And so that's what's so important when it comes to this collaboration. And again, with this population, a lot of data collection and sometimes difficulty with getting those things across. I've seen, I had a session recently we had one speech pathologist and we had an interpreter. He would be interpreting all of the sentences verbatim as they were. And he would say, well, he said this. And the speech pathologist will say, well, how did he say it? Was it, was it intelligible? Was it fully syntactic? And it ended up being a really difficult interaction. The interpreter got frustrated because they weren't briefed properly on what they should be looking for and how to relay that information. And so these are things that we can think about and talk about in advance as well. So that with that, considering how types of linguistic errors can be rendered or relayed in an interpretation to be recorded and addressed, as well as how should an interpreter go about modifying a message that is too linguistically complex for the child to understand. And so our children with receptive language deficits, the more complex and the more morphologically and syntactically complex the sentences, the more challenging it can be for them to understand it. And so, although we do always want to interpret things exactly as they were said, there can be a degree of difference between two languages in which maybe you're interpreting exactly as something was said in English, but in the language you're interpreting for, the way that you have to move those things around can make it a more syntactically complex sentence and thus difficult for the child to understand. Okay, so these are actually our questions for our breakout rooms. And I also have a sheet that I will be sending in the chat that has these same questions for everyone to remember. But so I want us to really engage in some discussion about, firstly, has anyone interpreted for SLPs and what were those sessions like? What were some challenges you experienced? Secondly, what challenges have you experienced interpreting for children with communication disorders in general? And if you don't have that experience, what challenges could you anticipate running into? And finally, I would like everyone to at least focus on one of the four disorders that we've addressed and discuss about how you might approach working with one of those populations. What are some obstacles and what are some strategies that you might use? So I'll go ahead and send that sheet into the chat and we can go into our breakout rooms. Okay, and also, if you guys come up with any questions, I would love to address those after the breakout discussions. I do have a few other things to just kind of cover and wrap things up, but I certainly don't have all the answers. I want to hear your questions.
All right, everybody. So here we go. We'll go into our breakout rooms. And once again, thank you, Devin, for that great presentation.
Welcome back. Welcome back. The rooms were very, very busy. So we would like to hear from one person per group in really a minute or so. What were the biggest takeaway of your conversations? And then we let Devin kind of make comments, wrap it up, ask you more, and we go from there. So group number one, and I do not know if we know what group number one was, but feel free to raise your hand. Go ahead, Alejandra. So Alejandra was in the group with, raise your hand if you were in the group with Alejandra. Awesome. Go ahead.
I think should I think a lot of us and chime in if I don't say the right thing, but I think a lot of us in our group had never participated in evaluations with an SLP. Cindy had, and also Vanessa had, but the rest of us, like my experience is interpreting at IEPs. And what we share too is like when they have asked me, which is not very often, if to go and interpret at an evaluation meeting, I always decline because I feel that I have not been trained to do that. So I decline and I give reasons, and now I'm very grateful because Devin gave me more language to use when declining an assignment. Not everybody has the same luxury. Like Vanessa, she has to go where they ask her to go or call in sick at her district. But most of our interactions with speech and language pathologists have been at IEP meetings. Also, we were wondering, Paloma was wondering, like if you're interpreting at a session, right? And let's say it's an articulation evaluation. And how do you repeat the word mispronounced? How do you do it? Like we really don't know. And that's why I don't do it. Or do you say articulation error, or how do you handle that? So that was the question. And I don't know if I missed something. Oh, another thing that we established too is that it's important to study before your session, like if it's more than just the regular things, so you are prepared, and have conversations with the speech and language pathologists when you're interpreting, because sometimes they tend to use high register language that it doesn't matter if you interpret it correctly in Spanish, the parents are not going to understand. So what's the point? So what we have done in my district is a lot of them do this. They speak in plain English, so we can interpret into plain Spanish. And if they need to explain something, they do it. Like we only interpret. Like if the parent asks, we ask the question, then the case manager explains. And I think that's about it, right, guys? Girls? Okay. That was group
Thank
one.
you. Thank you, Alejandra. So we have all of this down. Next. Okay, who is the next brave person on our screen? Go ahead, Pat. Are you muted though? We want to hear your voice.
Yeah, there I go. Okay, thanks. So this will be hard. There was a very good conversation. It seemed like we had a very heterogeneous group, which is good. From somebody who is I think a supervisor in language access who doesn't interpret, to other people who are, part of the school district, and then others like myself who's a freelancer. So I think a lot of the common challenges that were noted had to do with the lack of training for interpreters when they're working with SLPs and just being thrown into a situation. I know that that's been my experience. And you know, trying to determine, because we're asked to do it in these evaluations, whether or not a speech pattern is indicative of a problem with speech, or is it even like the socio-emotional, whether it's shyness, or sometimes the issue of they have to get evaluated in both languages, yet they're really functionally not very fluent in the language, for example, in Spanish, because they've been, you know, sort of been speaking a lot of English at school, whereas their parents are primary, you know, that's Spanish is their primary language. And so feeling as an interpreter, helping out with those assessments, that's feeling bad for the child, you know, and sort of that dynamic. We talked about the importance and the helpfulness of having a recorder, you know, like a device to record in the session, in those evaluation sessions, to be able to really help to understand what we've heard and be able to communicate that accurately to the SLP. One of our members, Andrea, if I understood this correctly, does home interventions. She does coaching of parents. And so sometimes it's, when she's trying to help the parents help their kids as they're learning words, and some of the, I guess there's a disconnect between the level of Spanish that I guess that the kids are learning versus what the speech clinician or what the parents are able to support their kids on versus what the clinician is interested is being sort of supported at home. I don't know if I've got that right, Andrew, if you want to jump in on that. We talked about autistic children and talk devices, but then all of the support for those devices, if I understood it correctly, are all in English. And even though there are pictures that come along with them, they work at school. But then when kids take them home, very little kids are not good for very little kids. I guess they're better for older kids. Let's see. Oh, and then in terms of the Mexican population, the Hispanic community in California, the issue of stigma for special education overall. And some parents are in denial, and sort of the challenges in, I guess, working in that setting with autistic kids in particular. And a lot of interest among at least one of our members to learn more about how to work effectively with children with autistic ASD disorders. Okay, anything else, folks, or did I probably got some stuff mixed up? Other team members want to jump in?
There was one interpreter who mentioned how she deals with the situation when there is a mispronunciation of the word. Which I don't know if you recall that. It was very interesting that she just omit one letter and she kind of gives in the bracket and the real name, something like that. If that speaker can speak right now and just explain how she does that.
Yeah, so when I take language sample of the students when we are testing, I write down exactly in the home language. I write down Spanish in my case, exactly how the student says it. And so if instead of saying pato, which is duck, says only the ending of the word, that's what I write down, the ending of the word. And in parentheses, I will write down the full word, because then when I'm chatting with a speech clinician, I'm not going to recollect everything that he missed. So I need to have my kind of chit chat of what he wanted to say at that time. So then we talk about, oh, he's dropping off all the first syllables, he's substituting this sound for this sound. So my language samples usually are exactly as the student is saying. So if he grammatically is incorrect, it will be grammatically incorrect written, so the speech clinician can have a fully understanding of what the student was producing at the time. So that's how I work with a clinician.
I go next with for our group. My name is Hemi Periani. I'm Armenian Farsi Dari interpreter. In our group, we didn't have much experience with solo relationship with speech pathologist and the child, but we did IEP assessments. And in the IEP assessments, I recall one experience with speech pathologist herself had a speech impediment, and it was very difficult. For me, and I was just after 20 minutes getting clarifying questions, I felt like I should have excused myself. But hopefully it will never happen. But that was one-time experience. We consider cultural and environmental issues that these children come in. They don't have developmental impediments. They just are coming to a new environment, new culture. So therefore they stutter, they do have, they are fearful, they are not sure. So these aspects need to be considered with everybody, especially with speech pathologists. Awareness, and a speech pathologist, I believe, has to have superb communication skills and awareness of culture. And my team, my group shared that at the beginning of her school district, she had speech pathologists, therapists that expected the interpreter do the whole job. But then she set the boundaries for roles, and this never happened again. So role boundaries are very important, we figured. And Veronica in our group did more of a speech pathology one-on-one. If you like to add, Veronica, or if you like to add anybody, please go ahead with your input on this topic. Thank you.
Thank you, Amy. Veronica, if you're there, you can unmute yourself.
Yes, I'm here. How are you?
Good, how are you?
Got it. Good, good. Oops, there may be some echo. No, my experience was one-on-one, and I just follow the direction of the speech pathologist, the clinician, much like the other interpreter. You just write down the samples for the speech pathologist and explain what they're missing or dropping when they're dropping letters or syllables. So pretty much you have to, I was lucky enough to work with a couple of speech pathologists that were very good at guiding me as an interpreter how to best be that connection between the student and the clinician. And so writing samples, being very clear on the explanations, and definitely following their direction and their input just makes the whole process much easier.
Thank you. Devin, I think you have enough to take us to the next step. Take it away.
Yes, so I do have a few more slides that I was going to go over that are just kind of to wrap up some of those things and offer some suggestions. But I really like some of the suggestions that you guys gave and the ideas that you have. And in the interest of time, I'm wondering if I can send those slides instead as a PDF for you guys to review, so that we can use the last of this time to just really discuss some of those things you guys touched on and answer some of the questions. So while I work on that, I really like that some of you brought up, how do we interpret when there's an error in articulation or these sound errors? How do we relay those things to the speech pathologist? And the truth is, it's something that SLPs and interpreters have struggled with for a long time, so there's not an exact answer. What I typically do is similar to what I think Andrea was mentioning, where I'll kind of ask if the interpreter will be able to write some of those errors that they heard, and sometimes we'll have them transcribe a language sample. And someone else had mentioned the benefit of recording the interaction or recording the language sample. That's a really great thing to do. And some SLPs even do that, typically the less experienced ones, but you guys as interpreters, it can be really, really beneficial to be able to go back and have that recording and transcribe some of the things you heard, because I'm not sure who it was that mentioned, do we interpret the articulatory errors in real time? Do we interpret, do we render an error in our interpretation? And that's really just not possible, because the sounds are going to change from one language to the next. So if a kid, I'm a Spanish interpreter, so I can only give a Spanish example. But if a kid says pescado instead of pescado, he's switching that D for an S, and you say some variation of fish, even if you insert an error into your interpretation of fish, it's not the same error anymore. It's a totally different sound error. And so a great thing to do is definitely, I have some of my interpreters transcribe the samples and write things down so that then we can look at the overall patterns and kind of identify what's happening there. I love that so many of you mentioned that there's such a lack of training. And I think that's one of the big issues and one of the reasons that it's often difficult to have this interaction between SLPs and interpreters, and even why so few interpreters are out there that specialize in working with us or that are willing to work with us, is that there really is a big lack of training. And part of the problem, at least from an SLP standpoint, is just that it can get so complex and there's so many different things that we would have to train on depending on what you might see, that we have such a wide scope of practice that it would essentially be sending you guys to grad school to learn so many different things. But I think definitely there would be a benefit of having more kinds of trainings and things that similar to this, but that we can go a little bit deeper into specific subjects. But when you interpret with an SLP, there's so many different things we see that you won't know which of those subjects you'll get. And so I really think as SLPs, we do also have to do a better job of providing strong briefings, having strong rapport and connections with our interpreters that we're consistent with, and just explaining those things better, especially when it comes to what are we looking for and how can you help us identify it. What else did we, I like that someone mentioned about setting role boundaries, because that is also, again, we as SLPs, we need interpreters so much. We are just a predominantly white monolingual field that almost always needs these interpreters. And truly, you guys are the experts in your languages and in the sounds and the typical language patterns of your languages, all of those aspects that we sometimes need to ask you to do things that are not really within your role. And it's so important to establish those boundaries, because SLPs also don't have a whole lot of training in how to work with interpreters. Like most healthcare providers, I've found we're just not taught how to navigate that well. And a lot of us don't fully understand the role of the interpreter. So that's super important. And then we do have a few minutes that I would like to use to address any other questions that you guys can put in the chat or ask me outright. Now, this first question I see here, let me just bring this up. Apologies. From Vanessa. I have searched far and wide for English-Spanish glossaries for speech pathology. And so I'm about to put 3 links here into the chat. The first is exclusively an English glossary, and I find it okay, somewhat incomplete, but again, we have a wide scope. The second is only Spanish. So there's not really been anything that is strictly English and Spanish glossary together. The third link that I put is actually for a book that I wrote that I think is probably the only existing English-Spanish, collection of speech pathology terms, because I identified a real need for that, hadn't found anything like it, and I wrote one. So this is the second edition of my book that has some of those And then I would love to move to Andrea's question. I see you have your hand raised.
Yes, I have a question. When you were presenting, you mentioned about interpreters during sessions. In the district that I work with, Minnesota, we do not usually provide interpreters during sessions. So when, except in the Part C of evaluations, that would be birth to 3. That's when we do the home interventions, and there's interpreters because we are at the home. But once a child is in a school site, there is no interpreters during the sessions. So I was wondering how, I know it's only in the clinics. So just being in education, what do you see the interpreter in an education setting working with a speech clinician and the child? What experience have you had? I know you're in Texas. Maybe they do it that way in Texas, but it's just something that I thought because something I haven't experienced.
Yeah, I think everyone's experiences will vary in regards to that. I'll preface this by saying that I haven't worked anywhere outside of Texas, so I'm not entirely versed in how things work in other states, but I have seen a variety of different school settings. And in some settings, they are fortunate enough to have a bilingual service provider as a speech pathologist, or maybe a speech pathology assistant or aide that happens to be bilingual and can provide those services. And others, we do need to collaborate with interpreters. And so I'm not sure if there's a state difference also, but I would imagine that really in any setting or in any place, we always need to work with interpreters for those evaluations, those sessions, those therapies, because as I mentioned, we have to do our due diligence in ensuring that one, the language or speech disorders are present in the other languages as well, and two, that we're addressing all of the languages that the child speaks in therapy and not just focusing on English. So I think it's always important to work with an interpreter in those sessions. Ideally, any good speech pathologist, I think, would, but I have seen some that just try to wing it or don't necessarily respect the other language, and that's just a unfortunate thing with the SLPs. Yes, Giovanna. I think you're muted.
You're muted, Giovanna.
Rookie mistake, but you were paying attention. So you see, I said, I am a trainer at the heart. And so this is exactly the reason why listening to Devin's presentation at the summit was very valuable to me, because he was able to really look at the work that we do from the provider's perspective. Now think about it. We are interpreters, and we can actually not study for the specific expertise of every single person that we interpret for, right? So we need to give us some grace there, because like Devin said, I would send you to a master in speech pathology if I wanted to give you a training on every single facet. And then what about the rest of the things that we interpret for, right? But I think that what is important out of these sessions, as we discuss, is to really keep in mind what is important for that briefing. The briefing at the very beginning is to say, what is the purpose of this meeting? I have been supervising sessions where the pet therapist goes, oh, I want to see how you say the word duck. And the interpreter in Spanish goes with the word duck in Spanish. Pato. Oh, how did he pronounce it? Oh, well. Oh, good. But what was checked? Nothing. So the two were not talking to each other, right? The interpreter did not know what the therapist wanted to check on, and the therapist did not tell the interpreter what to look for. So duck and pato have completely different set of consonants, vowels, etc. So if the briefing does not allow us to lay out what is the purpose and how they conduct their analysis, their evaluation, we don't have a way to say, this is what I can do, this is what I cannot do, and how do you want me to do X, Y, Z, right? So to go to your comment, Alejandra, it's nice to understand what are our boundaries to decline an assignment. But like Devin said, we need more of us that do this type of work. And now we talk a lot about, Spanish. Think, oh, Emmy, are you still there? Or maybe Emmy, you're there. But in a language that Emmy speaks, if Spanish is 2%, I don't even want to think 0.0000 in the languages that Emmy speaks, right? Lastly, recording is a good thing, but please do not record without consent. So do not go to the meetings with your recorder in your hand, please. The recording is something that the provider can do and you can help, right? You can assist, transcribe, analyze, point out, listen and re-listen. Do not go into the sessions with your recorder, please. And I see that Julia has her hand up.
Yes, thank you. I was just about to ask about the recorder. And also, in our group was mentioned that, well, for instance, I am a freelancer, so I can decline, any assignments that I don't feel I'm fit for. But what happens, or what's the best practice when you're speaking about a in-house interpreter for school districts, and they don't feel prepared for this type of interpretation? What would be the best way to approach this, and maybe this would, bring up or highlight the fact that more training is needed in that area, I know, for the school districts. I don't know.
Yeah, there's definitely a need for more training in general. That's why things like this, EduTalk, are so great. But also, I go around and I work with other SLPs as well and give presentations on how we can brief interpreters and how we can work with interpreters from the speech pathology side. Unfortunately, it's just not something that everyone implements or does well. And I wish that every speech pathologist in every school would take the time to offer some sort of brief class or some sort of ongoing training every month or something on the things that we work with. But I just can't make every SLP do that. And so I think there's a great need and a great opportunity for more trainings in this intersection of these two fields. But
So I have had the experience of shadowing, asking for before taking a position or a job or a duty that you're not used to or you don't feel comfortable, if you are allowed to shadow a couple of interpreters who have been in the field, in the school district for longer time, and they will allow, and with permission of the parent, they will allow us to have shadowing so they can get more experience and see how it goes. Sometimes it's hard to, what they tell you what you need to do, but when you are right there doing it, because there's a disconnection too. So shadowing, it's a good, if they allow you to, you can do that.
Go ahead.
I was just going to say really quickly to Pat's point on the chat, you were mentioning that, even for freelancers, it does become more of a challenge because, a lot of times you'll have, members of the team that, either they don't fully understand the role of the interpreter or don't really understand that we are part of that team. And so, it becomes a lot more difficult. So I'm glad that there are districts out there that will allow you to at least shadow in situations like that whenever you aren't sure whether you can handle an assignment or not.
And to reinforce what Luis said is, unfortunately for privacy issues, the ability to shadow is less and less and less. So from a training perspective, remember, asking questions about what is going to be is our right to do so and our obligation. 2, learning about what it is, what the problems are, etc. YouTube is full of examples of analysis. All the disorders that Devin discussed are there. 3, clarify with the provider, what is this for? What is the purpose? None of us will ever finish the interpreting career saying that we were 100% ready because we studied for every single interpreting session that we had, because we just cannot anticipate them all. Like I said, we interpret for many providers, but we don't have the specificity. But knowing how to do our job in asking the questions and having that briefing with the trainer, with the provider, is already a step ahead to show 1, our professionalism, to create the understanding of what needs to be achieved for the session. 3, it gives you feedback on, am I ready for this? Maybe you don't, but maybe you have no way to go back. So ask the provider to make it low register, simplify, and share your situation, and then go from there. Now, understanding that, yes, we need to talk more about these situations, these sessions in our field. Devin, I cannot thank you enough. He's also sharing his email. We hope to have a much more extended presentation that goes into more of a hands-on presentation and give us the opportunity to really work with the matter. And so we just at the EduTalk was for us a way to know, is there a need for more conversation about this?
Thank
Devin,
you all
thank
so
you
much for
so very
having me.
much.
And I got to listen in on some of the discussions, and I know that there's so much more we could talk about here, but I really appreciate everyone coming and having this discussion. Awesome. And so, yeah, I've left my email, I've left the additional slides with some other recommendations, and feel free to contact me for any more resources or things like that, because really we've only scratched the surface of some of this. Thanks.
Thank you, Devin. And don't forget to be tuned for the next opportunity and get back to us and volunteer for AAIT committees.
Yes, and I want to thank all of the people that participate in the committees. I have to leave mine, but yeah, we don't do it because we have extra time. We do it because we care, and yeah, I encourage everybody to participate also. Thank you.
Thank you, Adriana. Thank you. Have a
Thank
good
you.
evening, everybody.
Gracias.
Gracias.
Adios.
Ciao.
Hi, Julie.
Hi, Alex.
Valentina. Like volunteering for the committee. Bye-bye.